सर ऐसा है कि पार्ट 2 का एग्ज़ाम करीब आ रहा है, तो मोस्ट कॉमन जो शॉर्ट केस आता है, पहले भी आया हुआ है, वो थायराइड के बारे में ज़्यादा आया होता है. हाउ टू डील विद इट, द ट्रिक्स, शॉर्ट केस और अगर लॉन्ग केस में आ जाता है.
If you allow me, can I speak in English? Because some of our audience are actually overseas,
Sir.
or if not overseas, in the neighboring countries, and they always ask me to just talk in English. Actually, there is no set rule for a particular thyroid case. The principles of presenting a short case is actually same, no matter whatever is the diagnosis.
Sir.
The basic principle, like in FCPS exam, what happens is that you have got 10 minutes, and in 10 minutes, around 3-4 minutes you have to spend on doing the examination. And while you are examining, you are being observed, and examiners have got a checklist.
Sir.
And according to that they observe you, and that checklist is very structured. There is very little subjective involvement of examiner's own feelings in it. Right? Obviously, all of us are human beings, and we are sometime governed by halo effect. I hope you know what halo effect is. Halo effect is that when someone just comes, he actually sends some vibes. There are certain impressions you get from his attire, from his mannerism, from his style. And being a human being, all human beings, they get influenced by that. But these exams are so structured that halo effect is not actually very significantly determining the outcome of your result. Right? Now, during that 4 minutes, if you ask me to categorize it, what you're supposed to do is, number one, very good bedside mannerisms. Right? So, and moreover, saving the time. So there are 3-4 multitasking you can do simultaneously. For every short case, there are certain questions which are very important. For example, for thyroid, the important questions for me before really starting the examination is to know that what brought the patient to the hospital. Is there any chances that patient has hyper or hypothyroidism? Is there previous history of surgery? Is patient taking any medication? And is there any pressure effect of that swelling?
Sir.
Now, all these things can be asked just after doing your introduction. Hello, my name is Javed Iqbal. I'm supposed to examine you. I will be as gentle as possible. I'll make sure that there is no pain. If there is any problem, please let me know. What's your name? Okay, I have to expose you. I hope you don't mind that. And if there is any problem, please let me know. Since how long you have this swelling? Oh, right. So, do you have apart from swelling, do you feel that there is palpitation, or you have got more sweating? Is there anything you want to tell me related to that? Okay, and are you taking any medications for that? Because it is possible that your patient is thyrotoxic and patient is taking medication, and when you examine, you think that it is euthyroid patient. And did you ever had a surgery before? I remember in one of my short cases, last time maybe I was just examining a student, patient had a scar. And patient had actually a previous surgery, and there was a recurrence, but he missed that scar. Now, this is not fair, that if in a part 2 exam someone just misses that. So these 3-4 questions one has to ask, so that before he examines, he has got an idea that what he is looking at. Same is the case with hernia. Same is the case with any other short case. Like in case of a hernia, it is very important, since how long you have this problem, and what brought you here to the hospital, and what is your job? Do you have any chronic cough? Is there any is there any constipation? Is there any urinary problem? So these are few. Did you have a surgery before? So these are few questions which are very important for hernia. Similarly, every diagnosis has got certain questions which are mandatory to be asked. Okay, this is one thing. Now, once you just do that, then there is an algorithm for that. And before the exam, I will strongly suggest you that you just do a peer study or a group study. I mean, I know you have done your part 2, but when you are doing it with your junior colleagues, ask them to do a group study and just make a drill of it. For a thyroid, there is a drill, right? There are few things which you do from the front, there are few things which you do from the back, there are few things you do with the neck, then there are things on the peripheral organs, but that has to be, Assalamu alaikum, kya haal hai aapka? And that has to be a drill, and that drill has to be mastered and rehearsed, and you take a stopwatch with it, right? In my opinion, whole thyroid examination should be finished in 4 minutes. And during 4 minutes, what you're supposed to know is where is the swelling, whether it is moving with swallowing or not, what is the upper limit, what is the lower limit, can you see the lower limit, right? And is there any other asymmetry over here? And is it tender, whether lower limit is palpable or not, then whether what is the consistency of it, is there any pressure effect, which means any hoarseness, which means any swallowing problem, right? And is there any attachment with the muscles, and then is there a lymph nodes, all the lymph nodes, whether they are enlarged or not. Then if you suspect retrosternal extension, then of course percussion part of it, right? So this is, and also shrugging of the shoulders, right? And then you have to examine the pulse, and you have to look for peritibial edema, and maybe the ankle jerk, right? And then if you are suspecting thyrotoxicosis, then the eye signs for that. Now all these things should finish within 4 minutes, and once you have finished that, examiner already has got an impression that you know everything. Now once you have done it, then the next segment is your presenting skills, and that need to be practiced as well. You know everything, but just try to make it as brief, as comprehensive as possible. And a good candidate is one which actually puts the question in examiner's mouth, right? By uttering those words which immediately triggers a question in examiner's mind. For example, if you say, well, there is a swelling 4 into 4 centimeter in front of neck, it is moving with swallowing, and clinically it is thyroid, the upper limit is palpable, so there is no evidence of retrosternal extension, and there is no evidence of hyperthyroidism. Instead of saying pulse is this, pulse is this, and pulse pressure is this, and there is no palpitation, I would say there is no evidence of hyperthyroidism, so that examiner asks from you, what are the signs of hyperthyroidism?
Yeah.
So that is the area where you are strong. So don't tell anything which the examiner has not asked from you, right? So just describe it in a very precise manner. And then most of the time examiner will ask, okay, what is your differential diagnosis? And then one has to be able to correlate the clinical findings with that of the possible diagnosis, right? And then he has to make a priority list as far as the possible investigations are concerned. And usually then there is a very little time to ask, okay, what are the management options? So this is how the short case viva it goes. I hope it answers the question.
Yes.
What's your roll number?
So 857.
Examine the neck of the gentleman, please. Time starts now.
अस्सलामुअलैकुम, मेरा नाम डॉक्टर सिद्धा है और मैं डॉक्टर्स की उस टीम का हिस्सा हूँ जो आपकी बीमारी से मुताल्लिक कुछ सवाल जवाब करेंगे और आपका मौला करेंगे। आप तैयार हैं? आपका नाम क्या है? चलिए मैं आपको थोड़ा सा कॉलर सीधा करूँगी। Sir, I am considering you as a chaperone to examine this patient. So I need full square, ideally shirt should be off. थोड़ा सा मुझे अपना सर पर रखिए, हाथ सामने रखिए। ये बताइए ये मसला कब से है आपको? ठीक है, ये पानी का एक घूंट मुंह में रखिए जब भी कभी दबाव में निकल जाए। अच्छा, अब इसको निकलिए प्लीज। ठीक है, अच्छा अपने दोनों हाथ इस तरह से सर के ऊपर ले जाएं और कानों के साथ लगाएं। ठीक है, आपको अगर कोई इसमें तकलीफ हो मसला तो मुझे बता देना, लेकिन चक्कर आना शुरू होगा। ठीक है, जरूर नीचे कर लीजिए हाथ अपने। अच्छा, इसलिए दुखता तो नहीं है हाथ लगाने से? अच्छा चलिए, इसके लिए आपने पहले कोई मेडिसिन इस्तेमाल की? कितने ऐसे से खा रहे हैं? ठीक है। अच्छा चलिए, अब आपको दोबारा से पानी का घूम लेना है। जब मैं आपको बताऊँगी तब आप इसको ले जाएंगे। पानी का घूम लेना निकलेगा। ठीक, कितने ऐसे से आपने मरकज़ और खा रहे हैं? 6 महीने से। ब्लड तो नहीं कराया इसके लिए? अब आपकी तबीयत इससे बेहतर रहती है या अभी भी आपको ये प्रॉब्लम है? अच्छा जी, मुँह खोल के ज़रा गहरा सांस लें। ठीक, अब दोबारा है। ठीक, थोड़ा सा सर नीचे की तरफ झुका लें। गर्दन में आपको कोई पेटियाँ नहीं महसूस होती? इसके अलावा थायराइड के अलावा थोड़ा सा कंधे ऊपर उठाएं। बस ठीक है, नीला छोड़ दीजिए। अच्छा ये बताएं कि सर में कभी कोई दर्द की शिकायत या पीछे कमर में? ठीक है, थोड़ा सा ऊपर फेस अपना ऊपर की तरफ देखिए और छत की ओर देखने की कोशिश करें। ठीक है, ठीक है। अच्छा ये जब हाथ में करिएगा ये बताएं कि अभी फेस महसूस होती है? अच्छा अपने दोनों हाथ ऐसे ही सीधे सामने रखेंगे और उंगलियां खोलेंगे। ठीक है, हाथ नीचे रखिए प्लीज। अच्छा देखिए, मैं आपको कमांड दूँगी, आपने पेन की इस नोट की तरफ देखना है, इस नीली नोट की तरफ। ये जहाँ जाएगी नहीं देखना, आपने सब नहीं है। इसको फॉलो कीजिएगा प्लीज़। अगर आपको इस दौरान धुंधला नजर आना शुरू हो जाए या लोगों नजर आना शुरू हो जाए तो आपने मुझे बताया। ठीक, बहुत शुक्रिया। गहरा सांस लीजिए, दोबारा से। अच्छा जी, अपना ट्राउजर जो है ऊंचा करना, मुझे अपनी टांग का मुआयना करना है। शुक्रिया। और ये टांग दूसरी टांग पे रख लीजिए। बहुत शुक्रिया। आंखों बिल्कुल ढीला छोड़िए, आपको दर्द नहीं होगा तकलीफ में। बिल्कुल ठीक है, बहुत शुक्रिया जवेद साहब।